All right, everybody. Hello, good morning, good afternoon, good evening. It's Dr. Kaz here. I'm bringing you another supplemental video in regards to development. And so I would like to start off and talk about gastrulation. All right. This here, all right, we've kind of talked about the formation of our embryo and then fetus. And now we're going to talk about, all right, this process of folding, all right, that occurs in the third week of development. All right. Now, as it says here on the screen, it is a critical period, and it's true because during this period of time, we are going to form what is known as the primary germ layers. And it's these layers that all the tissues of our body are going to arise from or develop from. Okay, those three layers are called the ectoderm, the mesoderm, and the endoderm. See, at this point, all right, we're only dealing here, all right, with the hypoblast layer and the epiblast layer. So we have two layers. And at the end of this gastrulation here, now we're going to wind up with our three primary germ layers. All right, so don't forget, when we talk about all the tissues of the body, we're referring to all the epithelium, all the connective tissue, all the muscle tissue, and all of the nervous tissue are going to come from these three layers. All right, when we have these three layers, then we can officially call, all right, our developing structure an embryo. All right, you officially give it the name of embryo. Okay, so what starts off gastrulation is when you're looking down from a superior view down onto the epiblast layer, okay, you'll start to notice this streak. So this kind of line starts to invaginate itself into, all right, the epiblast. So you'll see this depression occur. And at one end of the depression, all right, you'll have this structure in which we call the primitive node. All right, and the primitive node is a slightly elevated area, okay, and then it surrounds what we refer to as the primitive pit. Okay, so you'll have this slightly elevated area here, okay, and then we have our primitive pit here, and then from our primitive pit, you'll start to see this long streak just start to occur. Okay? And during this invagination, all right, these cells, all right, start to detach themselves from the epiblast layer. Okay? That top layer, I guess you could call it. All right? And they start to detach themselves from that layer and push downwards towards the hypoblast layer. Okay, and when they do that, they form that primitive streak there. They push down into that streak, and they're actually going to push in between the epiblast layer and the hypoblast layer. And because of that process here, then we're going to wind up with our three layers. All right, the bottommost layer we'll refer to as the endoderm. Okay, and these are the cells that are going to displace the hypoblast layer, that lower layer there. The mesoderm, this is brand new. We haven't seen this before, so it's a new layer, all right, and it pretty much comes from those epiblast cells that have pushed their way down. I'll show you a nice picture here in a moment. Okay, and then finally on top, we'll have the ectoderm, and those are the cells that just stayed there. They didn't really go anywhere, all right, and they came from the epiblast. So essentially, the epiblast is going to form, all right, these three primary germ layers. All right, and so all these tissues that I mentioned before are going to come from these primary germ layers. So if we look at our picture here, this is what we're going to be starting off with. We're going to be starting off with, here's our bilaminar disc, okay? So you can see what we're doing. We're just taking a slice here through, all right, our structure. You can see we're looking down from the top. So here's the epiblast layer, down here is the hypoblast layer. Okay, so you start to see, all right, we get our primitive node here, all right, and then we have our primitive pit, and then we start to get this streak that runs down. And these cells will move in from the epiblast down into this streak, and they'll start to displace some of the other tissue cells down in there, which we'll get to in a second. All right. So at this end here, this is the cephalic end. That's going to be where the head is going to be. And then down here is the caudal end. That's going to be, all right, near the tail, all right, or the rump, okay, the baby's bottom. So again, we're starting to see this in the beginning of week 3. So if we look here at this view, now we're just going to take a nice transverse cross-sectional view, and we'll show you as these cells are displacing from the epiblast, they push down in here in between the two layers of the epiblast and the hypoblast. All right, so we're getting these new cells moving in. All right, so when we're done, you can see now we have our ectoderm on top, our mesoderm in the middle, and then our endoderm here on the bottom. All right, and there's this cavity up above, that's the amniotic cavity, and then down below is another cavity, that's our yolk sac here. Okay, so we look closer. Okay, here you can see, here's the amniotic cavity with the amniotic fluid in it. Here's our yolk sac. Here you can see we have our mesoderm. All right, we have our ectoderm, and then on the bottom we have the endoderm. We're starting to get the formation of the notochord, all right, and that's going to be the beginning, all right, kind of, it'll eventually turn into parts of our spine here. Okay, so we'll see here in the 3rd week the formation of these 3 tissues here. All right, so now we're going to see what happens. All right, we're going to just start to transition or move towards our fetal stage there. And so in order to get to that fetal stage, all right, our embryonic structure is going to start to take on a humanoid shape. But in order to do that, it needs to undergo, all right, folding. So there's 2 types of folding that are going to occur: our cephalocaudal folding and our transverse folding. So I'm sure from the terms that you see there, you can kind of guess what that means. So the cephalocaudal, we're going to start to fold forwards, all right? So essentially, this disc that we have, all right, this 3-layered disc is now going to start to fold forward, and then it's going to also fold in from the sides. So it's almost like if you want to lay down flat on the floor, and then the cephalocaudal folding would be like you, all right, trying to reach over as you're laying on the floor and touch your toes. So you bend forward, bring your head up towards your feet there. All right, that's the cephalocaudal folding. Transverse folding is going to be folding, all right, if you had your arms laying out, if you're on your back, and then you bring your arms in front of you, all right? So you start to touch your hands in front. That'll be our transverse folding. So let's start off here with the cephalocaudal folding, all right? So we are here, you have to understand something. We're going to see some rapid growth going on in our embryonic disc, which is those 3 cell layers that we were talking about, and also in the amnion here. But guess what? Nothing happens, no growth with the yolk sac here, all right? So again, this is where we're going to start to see the future formation of our head and our rear ends here. So if you see here in our pictures, okay, here's our disc, all right, and now we're going to fold, all right, from our head down towards our rear end here. You can see how the ends are starting to fold forward. And this is going to occur from week 3 into parts of week 4. Here's the connecting stalk, all right, just to try to give you a little bit of perspective. Our connecting stalk is where our future umbilical cord will be. So our yolk sac is here on the bottom, okay, and the amniotic cavity is up here. So we start to fold forwards here, almost kind of pinching off the yolk sac as we're doing so. And then the amniotic cavity starts to kind of cover our embryo here. All right, so this is the cephalocaudal folding. All right, the other type of folding is going to be our transverse folding. All right, so this is where we start to get both left and right sides of the embryo are going to kind of fold inwards, all right, towards our center line or our midline here. All right, so a lot of your structures, and I have talked about this in previous occasions and other chapters and topics of this course, where I've talked about, all right, that midline structure, when we talk about the linea albia, for example, all right, that there is a result of our transverse folding here. All right, so you'll see there's several structures, all right, that are formed as a result, all right, of this transverse folding here. All right, during the transverse folding, all right, we're going to see the beginnings of the yolk sac getting pinched off. All right, and our embryonic disc, all right, our left and right sides of the embryonic disc are going to fuse in the midline area here. So as a result of this, all right, that ectoderm is going to take more of an exterior position of the embryo as things start to fold forward, okay? And then the endoderm, all right, that's going to be that bottom layer, will be more in the internal areas of the embryo here. Okay, so what we'll see now really nicely in this transverse folding is now we're going to get the creation of our torsal region here. All right, with relative pinching off here of the yolk sac, okay, from the endoderm here. All right, so here you can see when we're looking at our structure, you can see here our left and right, or excuse me, our right and left sides here, they're starting to bend forward, moving forward and pinching off the yolk sac here, all right, leaving this temporary structure, this vitelline duct, all right, which will be the connection point between the embryo and the yolk sac here. But as you start to get this folding through, we're going to get the creation of several different structures. You can see here, all right, the ectoderm is now going to take more of the external region here of the embryo. All right, and then our endoderm here on the inside, you can see as it's folding forward, all right, is going to take more of an internal. And then, of course, the mesoderm will be kind of caught in between here of both those structures. But we'll see during this folding the beginnings of our primitive digestive tract, our gut tube. All right, we'll also see the formation of some of these structures called somites. We'll talk about that in a moment. All right, and then we'll also see the beginnings of our neural tube. Really cool stuff. All right, so speaking of our germ layers, all right, I'd like to talk to you about the outer layer, the ectoderm. All right, that is going to again be, all right, our external surface of our folding embryo here. For the most part, the ectoderm is going to be responsible for the creation of our nervous tissue. Okay, so we call this process, all right, the differentiation of the ectoderm, all right, in regards to the nervous system as neurulation. Okay, so also from the ectoderm, all right, because it is on the external surface, as is our epidermis, we're going to derive our epidermis, all right, from the ectoderm. Some of our sense organs, the pituitary gland, and another structure of the endocrine system, the adrenal medulla, the covering to our teeth, the enamel, and then obviously we're going to have the covering, not the covering, but the lens of the eye, all comes from the ectoderm. Now the mesoderm is a little bit more involved in the mesoderm. All right, there's going to be 5 categories for the differentiation of the mesoderm. All right, the one structure I mentioned before is the notochord. All right, and the notochord, all right, is going to be where we get our central body axis. So hence, the axial skeleton is going to be derived from the notochord. Right, and we'll also get, all right, when we have the formation of the notochord, our neural tube. That will play a role here. All right, in, all right, the formation of certain neurological structures here. So, and I'll show you a picture here in a moment, all right, but this one area or category of the mesoderm, we call it the periaxial mesoderm. All right, this is going to be immediately on either side of our neural tube there. All right, we have these structures called somites. All right, and there's these block-like structures, all right, that are going to sit on either side of our neurotube, and they're going to help to form the axial skeleton, all right, muscle tissue, all right, the cartilage that we're going to find in both the axial skeleton, the muscle, and the skeletal, the axial muscles, all right, and we'll also get dermis and connective tissues from this. So there's quite a bit that comes from the mesoderm, but we're not done there, because in addition to that, in our intermediate mesoderm, so we're going to move just a little bit out towards the sides from the periaxial mesoderm, and then we're going to get the formation of our kidneys, our ureters, and our reproductive system. All right, now let's move further out from that. Our lateral plate mesoderm, all right, is going to form our spleen, the adrenal cortex, and our cardiovascular system. We'll also get the formation of the serous membranes. All right, we saw the importance of those. All right, the lining of cavities and certain organs within our abdominal and thoracic cavities. All right, but we'll also get connective tissue of our limbs. So now we're going to start dealing with the appendicular portion of our embryo here. And then finally, when we get to the head mesenchyme, we are going to get the connective tissue and the muscles of our face. All right, so if we look here, all right, at our mesoderm, all right, nice cross-sectional view here, you can see, all right, here centrally is the neural tube. All right, just below it is the notochord. On either side, we'll have our somites, but then we'll see our neural crest cells. Then as we move laterally, or from the medial portion out to the lateral portion, here's the periaxial mesoderm, all right, our somites here. All right, then we move further out to the intermediate mesoderm, and then finally the most lateral portion is the lateral plate mesoderm. Okay, still on this structure here, all right, this picture you see on the top portion, we have our ectoderm, that's going to be the external lining here. And then we have our endoderm, that'll be the internal lining for our embryo there. All right, and then finally the last layer, our germ layer, is going to be the endoderm. So remember I said the endoderm is going to be internal, all right? So think of the structures that are internal to our body, all right? So pretty much the linings of the gastrointestinal tract, the respiratory tract, the urinary tract, and the reproductive tracts. All the linings to those systems are derived from the endoderm. All right, we'll also get the tympanic cavity there and the auditory tube. And then we have a couple organs that are derived from the endoderm: liver, gallbladder, and pancreas. And if you notice, all three of those have a role in GI. Okay. Then we have the palatine tonsils, and then a couple glands here: the thyroid gland, the parathyroid glands, and the thymus. All right. So this slide here will show you pretty much a pretty good idea of all right, the derivatives from the primary germ layers. I do suggest that you take a quick glance at this, read this over, see what we're dealing with here. All right, this is just one of those issues in which it's pure memorization. All right, but if you understand, all right, the derivatives of these primary germ layers, it'll help your understanding later on, all right, when you get to some more advanced concepts in regards to pathologies to these layers here, okay? All right, so let's get to the last portion here of the development, all right, of the fetus, all right? When we talk about, well, I shouldn't say the last portion, all right, but one of the big portions, because when we get to organogenesis here, we're essentially talking about the formation of these organs, but also, all right, when we get into the fetal growth period, how these organs are just going to continue to develop, all right, and form the organs that are present at birth, okay? So by week 8, here we're going to see, all right, a structure that pretty much resembles, all right, an adult shape, all right? So we'll have upper and lower extremities. We're going to have a torso, all right? Also during this time, all right, we have completed all the folding that we're going to do. So now it's time to kind of, like when you're baking something, all right, now you gotta let it cook for a little while. And during that time, all right, we have to start to get development, all right, of the tissues and the organs of our organism here. All right, so by week 8, we have just reached the end of the embryonic period. Now we're going to transition into the fetal period. But during this time, all right, when we're in this organogenesis, all right, as these organs are developing, all right, which is great, but at the same time, we have to be careful, all right, of the introduction of these substances which we call teratogens. All right, teratogens, all right, are harmful substances that can cause birth defects or even death in some situations. Okay, drugs, all right, tobacco, alcohol, some viruses, certain pathogens can cause, all right, damage or even death, all right, to these structures, all right, that will result in the organism's death if it's bad enough here when we talk about certain birth defects. Okay, so this right here, when we talk about organogenesis, all right, our peak development period, all right, is going to range or vary depending on what organs, what limbs are occurring. All right, when we talk about the limbs, all right, that's between weeks 4 and 8. Now, there's a drug out there called thalidomide, and they did not know that it had some harmful birth defects. If a pregnant woman was taking thalidomide, all right, their offspring, their child, all right, if it was during this period of the 4 to 8 weeks, all right, they could actually have an issue in which their limbs looked like flippers. They called them flipper babies. All right, obviously thalidomide is no longer used, all right, but it's an example of what can occur, all right, when you introduce a teratogen, all right, to a developing organism, okay, during a crucial and sensitive time, all right, you can get that birth defect occurring. All right, so the last period that I want to discuss during development, all right, of our fetus, our embryo, all right, our organism is the fetal period. All right, and this starts at the beginning of the 3rd month and goes all the way to birth. So if you go back to our wheel, all right, this is going to be the last phase here. All right, so here, like I said, all right, we have our organ systems developing. Okay, so at this point now, we're going to get the maturation of those organs and the tissues, all right, that have developed from our primary germ layers here. So a lot of growing goes on in this period. All right, so we'll see a significant size, all right, of our fetus, all right, during the fetal period from the onset to the completion just prior, all right, to birth here. All right, so we'll see an amazing increase of weight, all right, in the fetus in the last 2 months of the fetal period here. All right, so if you look here at this table, all right, I'll zoom in a little bit. I won't be covering everything on here, all right, but I want you to just kind of see, all right, when we discuss, all right, for weeks 9 through 12, you're going down here and you're reading through and learning, all right, some of the events that are occurring. You can see a lot of just growing, like for example, the brain enlarging occurs. All right, now we'll start to see, all right, areas where we'll start to get elongation of the tissues that are going to give an overall increase in size. Because if you compare weeks 9 through 12 to weeks 21 through 38, there's a significant, especially during weeks 21 through 38, we are going to see large weight gains, all right, in our fetus during this time. All right, so think of the fetal period where, all right, we have the development of these rudimentary organ systems. Now we're just going to mature these organ systems as they go through their development phase. They're going to enlarge, all right, they're going to become a little bit more complex. All right, so we're just going to be adding on, all right, to what we already have, all right, for growth, hyperplasia, hypertrophy of tissues are occurring. Where at the same time, you will get, all right, atrophy of tissues too, all right, because we're going to be replacing older tissues with newer tissues, all right. So a lot of different things are at play here, all right, when we're discussing the fetal stages of development. So when we talk about the course of pregnancy, all right, we divide pregnancy into 3 trimesters, all right, because normally pregnancy is going to be about 38 weeks, can be as long as 40 weeks, all right. So the first 3 months of pregnancy, we refer to that as the first trimester. That's when we start off with our zygote. Our zygote then transitions into an embryo, and then finally we wind up at the end of the first trimester with a fetus. And that's what we're, I hate to say stuck with, but that's what we are left with for the remaining trimesters, for the second and third trimesters here. Right? In our second trimester, all right, we will see continued growth of the fetus, right? But we'll also see, all right, the further growth and expansion of the maternal tissues. All right, when we're dealing with the uterine lining here, the growth of, well, it's a shared tissue of the placenta, all right, between the mother and the child. All right, then finally, our third trimester, all right, the last 3 months, this is where we see the most rapid growth here. And while this is occurring, the mother's body is preparing, all right, for the birth of the fetus. All right, so you'll start to get increased breast tissue growth, all right, in preparation of the mammary glands, all right, for the production of milk. All right, we'll also see several hormones that are in play, and we're going to talk about those in a moment, all right, in what is going to occur as we're preparing, all right, mom for the birth of the fetus here. All right, so again, everybody experiences pregnancy differently. Okay, I had a family member, an in-law, that for the majority of her pregnancy, she felt awful. Constant morning sickness, nausea, vomiting. So for some, it affects some people worse than others. Okay, and for some folks, they have a relatively mild experience when it comes to pregnancy. All right, so again, it varies from person to person. Most commonly, we'll see for folks that if they have morning sickness in the first trimester, that usually tends to improve in the second trimester. All right, they might improve, but again, like I said, it varies from person to person. All right, so it's kind of tough. So some folks might have an easier pregnancy, others might have a little bit more of a difficult time during pregnancy. So let's talk about some of the changes in the hormones that are going to be produced, all right, during pregnancy. So of course, estrogen and progesterone, all right, we saw their importance early on, all right, during the ovarian uterine cycles, all right, and they'll continue to have an importance in the role of the pregnancy, all right. Estrogen and progesterone are initially produced by the corpus luteum, all right, for that first trimester until we get the development and the maturation of the placenta. By the second trimester, the placenta takes over, all right, the production of estrogen and progesterone. Then the corpus luteum then degenerates into the corpus albicans. All right, so at this point in our second and third trimesters, we're going to see an increasing levels of estrogen and progesterone being produced. Now, what that will do is that will suppress our follicle stimulating hormone and our luteinizing hormone for good reason. Okay, we want to arrest and stop the ovarian cycle. We don't need any more follicles, all right, to develop and mature because we've already had fertilization occur. Okay, so by suppressing, all right, our follicle stimulating hormone and our luteinizing hormone, all right, we then kind of stop the ovarian cycle from occurring, which is fine because we don't need any more follicles. All right, so our estrogen and progesterone will continue, all right, its effects on the uterus, all right, continue the growth of the uterus. All right, will also, for some of our accessory structures, all right, like the breast tissue, the mammary glands, like I said before, will increase in size, getting ready for the production of milk. All right, we'll also start to see, all right, an increase in a lot of metabolic activities in our tissues, and I say our tissues, in the mother's tissues here. So the mother might notice their nails are growing faster. All right, their hair is coming in thicker. We'll see the relaxation of the ligamentous joints, excuse me. That's important because of the production of a hormone called relaxin, which we'll talk about in a second here. But again, all right, we have to prepare mom, all right, for the delivery process during labor. And during that birthing process, if it's going to be a vaginal birth, all right, the baby needs to leave, all right, the uterus through the birth canal there, all right? It's not a very big opening. Okay, so we need to kind of ease the passage of the baby, the fetus, all right, as it's leaving the uterus. So the body produces this relaxin, which causes the ligamentous joints to become more lax. So there's a little bit more movement that can occur to accommodate the birth of the child here. All right. We'll also see further growth in the functional layer of the endometrium. This is in a large part by progesterone. Okay. We have to maintain that layer, and we have to contribute to it more to sustain the growing needs of that fetus there. All right, so I talked about relaxin. All right, relaxin not only helps with relaxation of the ligamentous joints, but it also helps to promote the increased growth of blood vessels in the uterus here. Okay, we will see it produced by both the corpus luteum and the placenta. Once the corpus luteum degenerates, then it's pretty much the placenta that is going to take over the production of relaxin. All right, corticotropin releasing hormone is released or secreted from the placenta, all right, and it is going to help, all right, increase the release of aldosterone. As we know, aldosterone is going to increase fluid retention, all right, by decreasing, all right, fluid in the urine. Okay, and again, that's important. Mom needs to retain as much fluid as possible to meet her metabolic needs and to meet the metabolic needs of the developing fetus here. All right, so aldosterone will cause fluid retention. In some cases, we'll notice edema, especially in those lower extremities, like at swollen ankles. Well, you can thank aldosterone for that, right? Right, we also have the human chorionic thyrotropin. All right, thyro is the thyroid gland. Again, this is secreted by the placenta. It is going to stimulate the thyroid gland to also increase mom's metabolic rate. Hence, like I said, we see one of the side effects, all right, increased nail growth, fuller hair, all right. We're just kind of increasing, since the metabolic demands, all right, are going to be increased because of this developing fetus. All right, we need to increase, all right, the basal or basic metabolic rate in a lot of the tissues of mom's body. We also have the human placental lactogen. Think of lacto, milk, all right, again, secreted from the placenta. Like I said, the placenta plays a large role in a lot of what's going on here, all right, in the developing fetus. Okay, so this is going to affect how mom is going to metabolize our certain macronutrients. All right, so normally the body likes glucose, it likes carbohydrates, cells prefer it. All right, but in this case, mom is not going to be metabolizing glucose as much. She's going to transition more into the metabolizing of the fatty acids. Fatty acids are great. We get a lot of energy from fatty acids, all right, long chain fatty acids, all right, that process of beta oxidation is a wonderful thing, okay, but mom is going to primarily transition more into the fatty acids, so we're going to save our glucose for baby. Baby gets the glucose, all right, so mom is not going to be responding too much to insulin like she did before. Not that it's a horribly bad thing, but it's just something that mothers need to know, all right, in regards to diet. Now, don't get me wrong, mom's not going to should not have any problems because of this transition, but it's still something they need to be aware of. All right, prolactin and oxytocin, all right, so there's several roles that oxytocin will play. Prolactin, obviously, is going to help with lactation, all right, the production of milk. All right, once this, after the mother gives birth, all right, she'll start to produce milk, all right, and we'll see a huge increase, tenfold, all right, by the anterior pituitary. Now, oxytocin plays a couple roles. It's going to play a role in uterine contractions when it's time for delivery during labor, but it also plays a role in milk expulsion. Okay, so it does quite a bit. So we'll see now, all right, if you remember, oxytocin, all right, is produced by the hypothalamus, all right, but then the hypothalamus, all right, releases it into the posterior pituitary where it's stored there, all right, and it's the posterior pituitary that will secrete the oxytocin, all right. So we'll see the hypothalamus producing large levels of oxytocin, all right. So at the time, we'll get into that when we get into some of the positive feedback mechanisms during labor, right? But we'll see quite a bit of oxytocin being released from the hypothalamus of the mom, but we'll also see some of that being released from the fetus, all right? Then once childbirth has occurred, oxytocin plays a role in milk expulsion here, all right? So we'll see a nice increase in that in the second and third trimesters, all right? And so we'll see that as a result of the rising estrogen levels there. All right. During this time here, all right, of the fetal development, the embryological development, all right, the uterus is going to have to grow and expand to compensate for the ever-changing, ever-increasing size of the developing embryo and fetus, okay? So once implantation starts, we will start to see this uterine growth and expansion here. So by week 12, all right, the uterus has grown just past or expanded just past the pubic symphysis. Pubic symphysis, if you want to palpate that out on your body, find your umbilicus, your belly button, go about 2-3 inches down, and you'll feel kind of a hard, bony material, okay? That is your pubic symphysis, okay? So by this time, around weeks 11, 12, all right, the uterus has expanded, all right? If it's an anteverted uterus, it'll be pressing over on top of the urinary bladder. This will cause, all right, pregnant women to have to urinate more frequently, okay? The bladder will not be able to fill up as much as it used to, okay? So we'll see this quite a bit during the first and third trimesters, all right? So when we talk about this uterus expansion, all right, I want you to think of both hypertrophy and hyperplasia. What is that? Well, remember, the myometrium is made up of muscle tissue, okay? So not only will the muscle, that layer, all right, the myometria increase in width and in size and girth, it's because we're getting an increase in the number of muscle cells there, but also those muscle cells are going to be growing. So we get both hyperplasia and hypertrophy. That is to accommodate, all right, the growth of the placenta, which is accommodating the growth of the fetus, right, but also an increase in our amniotic fluid too, okay? So when we get to week 16, we'll see the fundus, that top portion of the uterus. Now it is going to be between the pubic symphysis and the umbilicus. All right, quite large. For a short period of time, you may see a slight decrease in the frequency of urination. All right, but when we get to the third trimester, by 36, 38 weeks, that 9th month there, the fundus can be as high as the xiphoid process, which is the most inferior point on our sternum here. All right, but at this point, all right, the placenta is pretty large, the uterus is pretty large, all right, for that growing fetus there, all right, and that fetus can vary anywhere between 4, 8, 10 pounds, all right, so that is going to be displacing and compressing some of the organs, all right, in the abdominal pelvic cavity there, all right. One of those organs is going to be the bladder, but we can also see in some of the digestive organs there, namely the GI tract, all right, that mom can have some issues, all right, in regards to what is happening, all right, with their bowel habits. All right. Finally, our mammary glands, all right, during the first trimester, okay, we'll see some tenderness there. That is as a result of the estrogen progesterone levels increasing, all right. Also, we'll see the mother producing the melanocyte stimulating hormone. All right, again, this comes from the placenta. We'll see a darkening of the areola and the nipples. I've mentioned this before, how the theory is behind that. It helps the baby, all right, during the nursing process. All right, they don't have very good vision initially, but they can see that darkening of the areola, and it kind of gives them a target for that suckling reflex. All right, we'll also see the linea alba start to darken, and we call that the linea nigra. All right, and of course, we will have growth of the glandular tissue, namely the acini. All right, so we'll get an increase in the number of acini, but we'll also get an increase in the production, all right, of the milk, all right, from those acini. Here's a quick picture just showing you, all right, some of the changes here occurring in both the breast tissue. You can see there's an enlargement of some of the breast tissue because of the acini growing, right, having more secretory portions, all right, for milk production. But you can also see the size here of the uterus, all right, in our nulliparous, all right, female before she's pregnant. Now she's pregnant, and we can start to see the fundus here, that top portion of the uterus, all right, as we're getting development. By 4 months, we'll see that fundus between the umbilicus and the pubic symphysis. By 7 months, we can see that the fundus has surpassed the umbilicus. All right, it's above the umbilicus, but inferior to the xiphoid process. By by 9 months, we can see the fundus is just below that xiphoid process there. Okay. All right, I'm going to conclude the video here for now. Okay, let you kind of absorb some of that information, take it all in. All right, kind of chew on it for a little while. I hope you found this video to be helpful. As always, if you have any questions, you know what to do. This is Dr. Kaz. I will be seeing you in my next video. Have a great day.